Did a dentist tell you that dental implants aren't an option? If so, you're not alone. But what if I told you that there are advanced solutions available that can make getting dental implants possible, even if you've been told no before? In this video, I'm going to show you 3 powerful options that could get you into dental implants. Also, a new solution that has given thousands of people who have bone loss permanent dental implants in only 24 hours. If you're new here, I'm Dr. Rizk, a restorative doctor who helps patients get their smiles back through dental implants. We have restored many successful dental implant cases, and I want to share with you a few industry secrets that can help good people like you smile again. That's why I'm so passionate about this topic. We recently helped a patient, Michael, get his teeth in 24 hours when he was told no by previous dentists and had been through unsuccessful procedures. Number 3, bone grafting, a foundation for a house.
Building a case is like building a house.
The first and most common way to solve the lack of bone issue is something called bone grafting. Think of bone grafting like laying down a stronger foundation for your house. If your jawbone isn't strong enough to support an implant, your jawbone can be reinforced by adding new bone material. This creates a stable base so that implants can be securely placed later, just like building a house on a solid foundation. The only downside to bone grafting is after the procedure, it generally takes 3 to 6 months for the graft to fully heal and integrate with your natural bone before an implant can be placed. In some cases, if only a small graft is needed, healing can take as little as 2 to 3 months, while larger grafts can take longer. But the number one question that my patients ask me is, how much does a dental implant procedure cost? There are many factors at play, but also a lot of cost-saving tips out there. So if you're looking into dental implants, I've put together a free dental implant cost guide that shares factors that influence the cost and powerful tips that could save you thousands without sacrificing quality care. And you can get that in the description below. Number 2, sinus lifts. Raising the roof.
Raise the roof?
Now, sometimes the space between your upper jaw and your sinuses is too small for dental implants. That's where a sinus lift comes in. Imagine raising the roof in your house to make more space. Well, just like that, surgeons can gently lift the sinus membrane, add bone underneath, creating more room needed to place an implant. After the procedure, the healing time before placing dental implants is generally 4 to 9 months. This allows the grafted bone to fully integrate with the existing bone and provide a stable foundation for the implants. However, in some cases, dental implants can be placed simultaneously with a sinus lift. It depends on the condition of your bone. Number 1, zygomatic and pterygoid implants, anchoring into rock-solid bone.
Dropping anchor!
Now, for the most powerful solution, when there's just not enough bone for traditional implants in your upper jaw or your bone quality is poor, we don't have to give up. Surgeons who go through advanced training can do a special procedure using other bones in your face, known as zygomatic, cheekbones, and pterygoid bones. For certain patients, these areas can provide additional anchorage for dental implants, giving you the stability needed for a full set of teeth. These implants are often done in a simple surgical session because they anchor into denser bone like the cheekbone, zygomatic, or the pterygoid region, which is in the back of your jaw. They usually allow for immediate placement of dental implants and subsequently teeth. What's exciting about zygomatic and pterygoid implants is that they often eliminate the need for bone grafting or sinus lifts, so we can avoid the long wait. They are specifically designed for patients with severe bone loss and lack of dental bone density in the upper jaw. Since these implants bypass those areas where bone is typically insufficient, they provide a stable alternative without requiring procedures like bone grafting or sinus lifting. Here's the only problem. There are many dental implant providers that simply don't have the training or experience to competently perform these game-changing procedures. So what happens all too often is they tell you, sorry, you're just not a candidate for dental implants.
Sorry, Mr. Peterson.
Thankfully, the incredible team at Nuvia Dental Implant Center are experts in these advanced procedures. Many dental providers still rely on temporary plastic dentures right after surgery. They'll have you stay in these for months before getting you your permanent teeth. Not only does this prolong treatment, but hidden costs like sedation fees are often not included in the initial price. Nuvia has developed a better way. With nearly a decade of research and innovation, our innovative procedure allows us to deliver permanent, fully customized teeth in just 24 hours. No more waiting, no more temporary solutions, just a confident, lasting smile in a fraction of the time, for much less than a lot of other providers. The price you see is the price you pay. There's no hidden fees. It's all inclusive, from extractions to surgery to implants, even the sedation. Download that cost guide to compare options, discover cost-saving tips, and learn more about how Nuvia's cost process stacks up to the alternatives. You can download that free cost guide here or in the description below. I'm thankful we were able to help Michael, who was told he couldn't get dental implants. Check out this video where we show how we did it for him.